Welcome to Bullet Point Nursing. My name is Dr. Goldstein, and in this video, we're going to go through HIV and AIDS for your adult health Medsurg nursing course, and obviously to help you prepare for the NCLEX. Let's start with pathophysiology. HIV is called a retrovirus. The way it works is as follows. Once the virus gets into your body, through the process called reverse transcribing, the virus gets entered into your DNA. This is irreversible. Once it is entered into your DNA, you have the virus for the rest of your life. Let's jump it back and forth between the patho and the signs and symptoms boxes at the top of your screen so we can fully understand what this disease is. We begin with the acute phase. Once the virus enters your body, the patient can enter into the acute phase. This peaks at roughly 2 to 4 weeks after the patient is exposed to the virus. At that point, the virus is still getting transcribed into the patient's DNA. During the acute phase, the presentation is going to be with flu-like symptoms, fatigue, fever, things like that. Once that process is complete, the patient enters the latent phase or chronic phase of HIV. This can last anywhere in the range from 5 to 10 years. During this time, the patient is mostly asymptomatic. The patient may have some vague symptoms, such as lymphadenopathy, some random enlarged lymph nodes, and generalized fatigue. During this time, the retrovirus is destroying the patient's CD4 T cells. These cells are an essential part of the patient's immune system. And over time, eventually, the CD4 T cell count is going to get so low, the patient's essentially not going to have a functioning immune system. The next phase after the patient goes through the acute phase and the chronic phase is where the patient is essentially immunosuppressed. During this time, the patient may be clinically diagnosed with AIDS. Let's go over to diagnostics. So first we have our screening tool. How is a patient screened for diagnosis? And that is with the 4th gen HIV test. And yes, that is pretty specific, but that's still RN material. The patient's diagnosed by a follow-up test to confirm what the 4th gen HIV test does. But that is the test that we use for screening if a patient has HIV. If that's negative, we're pretty safe the patient doesn't have HIV. If it's positive, while it is highly likely, 80 to 90% accurate that the patient has HIV, we still do confirmatory testing. That's the main test that we use to see if a patient has HIV. Once a patient is diagnosed with HIV, then there are 2 main tests that you need to know for class of what chronic test, or not chronic, but what long-term tests we're going to do on a regular basis. Those are the HIV viral load and the CD4 T cell count. The HIV viral load, we want to be low, 0 ideally, and the CD4 T cell count, we want it to be high up in the normal range, which is over 500. If the CD4 T cell count gets low, the patient becomes immunocompromised. Now, AIDS is diagnosed in one of 2 ways, and this is a little bit depending on what textbook and what guideline you look at, but most of them you go as follows. A patient is diagnosed with AIDS if they have known HIV, they have a low CD4 T cell count, generally less than 200, and or, this is the debate whether it needs to include this or not, and or the patient has an opportunistic infection. Opportunistic infections are infections that hardly ever infect humans that have a healthy immune system. However, patients that are immunocompromised are at high risk for developing them. Things such as PJP pneumonia, which is pneumocystis pneumonia, or Kaposi's sarcoma. Those are 2 of the classic examples and the most tested on in nursing on what would be an opportunistic infection and what would show that this patient, highly likelihood that they have a depressed immune system because of this opportunistic infection, which makes it highly likely that they have AIDS. So now we went through patho, the signs and symptoms, and the diagnostics. Let's look at the nursing assessment. We have to assess the different modes of transmission. If there's a patient that we're suspicious that they may have HIV, some questions we would ask would be about the modes of transmission. For example, ask the patient if they have a history or are currently an IV drug user. And if yes, follow up if they share needles. Second, if you have a suspicion, ask them about safe sex practices. Specifically ask them about if they're male having sex with male. According to the CDC, the vast majority of all new cases of HIV contraction in the United States occur from one of those 2 routes, either sharing needles of IV drug users or males having sex with males. Other questions you would ask, and this is more so for patients that do have HIV, but your assessment would include the signs and symptoms to tell how their HIV is doing, would be to check their weight trend. Are they gaining weight or losing weight? Because unexplained weight loss is a known issue with patients that have HIV. An oral exam would be another common test question of what you would assess, because thrush or oral candidiasis, an oral fungal infection, is common in HIV patients. You would also assess for, as we mentioned earlier, the lymphadenopathy and fatigue, and of course for any signs of any opportunistic infections. Finally, if the patient is diagnosed with HIV and hopefully prescribed medications, you would also include in your assessment any recent labs to see what their most recent viral load and CD4 T cell count are, and also check for medication compliance, which we'll talk more about in just a minute. Your top two nursing priorities for test purposes of a patient that has HIV and is chronically being managed for HIV, number one is going to be transmission prevention, and number two is going to be medication adherence. Let's jump down to client education because we have both of those same two things again. In terms of transmission prevention, first of all, this disease is transmitted by blood, semen, vaginal fluid. It's not transmitted by holding hands or sharing a bathroom, so patients should be aware of that, but they do need to understand transmission. Patients, if they are diagnosed with HIV, will very often need emotional support, and they need to be extremely well educated on medication adherence and compliance, because HIV medication that we're going to get to in just a minute must be taken exactly as prescribed. If a patient misses even a few doses, the medications can completely stop working, the patient will become resistant, and then we do not have a treatment for them. Finally, let's just finish up client education. There's something called PrEP. PrEP stands for pre-exposure prophylaxis, and these are famous medications such as Truvada and Descovy. These are actually HIV medications, but they're not used to treat HIV. They're used because studies have conclusively shown that patients who are at risk of contracting HIV, who take this medication on a daily basis, these IV medications, Truvada and Descovy, even though they don't have HIV, they are at much lower risk of actually catching HIV. Therefore, it is highly recommended anyone who's at high risk of contracting HIV should be taking daily PrEP. When a patient is on PrEP, they are tested frequently for HIV to make sure that they didn't actually contract it, because if they did, the medication regimen changes. Let's look at the medications. So the treatment for HIV is called ART, antiretroviral therapy, sometimes called HAART. Now, this includes medications from 4 different classes. And generally speaking, patients are going to be on 2 or 3 or even all 4 classes of drugs. It's going to be a combination medication regimen, and the patient's going to have to take all their medications every single day without fail, or else they can very quickly become resistant to the medication. The drug classes are NRTIs, which are nucleoside reverse transcriptase inhibitors, and NRTIs, protease inhibitors, PIs, or ISTIs, which is integrase strand transfer inhibitors. Those are the 4 primary drug classes that we use for HIV. Finally, complications. The complications would be AIDS, which, if a patient does have unmanaged or uncontrolled HIV, will eventually end up with AIDS. And also, patients with HIV are at increased risk of malignancy. Hopefully you enjoyed this video and you're better prepared for class now. Do great in school, and we'll see you in the next video.